Namaste. Greetings from all of us at Apollo Hospitals and welcome to our Corporate Health Series. This is Dr. Srinidhi Chidambaram and I hope you're all staying well. I hope you've been enjoying these sessions that we have been presenting with the goal of giving you concise and pertinent information about your health and well-being. We really want you to be aware of common health conditions because knowledge is key to early recognition of diseases. And you know that early diagnosis leads to early treatment and better chances of complete cure. Today, we are going to talk about the most complex, ingenious thing in the universe, the human body. Our bodies are composed of amazingly complex organs that work in perfect harmony and perform a million functions. Without really thinking about it, we do things on a daily basis that are extremely complex to do. But we take our bodies for granted. We celebrate our ability to create machines that function like human beings, but we take for granted the amazing miracle that is our human body. If we can consider our material possessions precious and want to maintain and preserve them as best as we can for as long as we can, have we realized how much more precious our bodies are and spared a thought for ensuring that we are fit, strong and healthy? Unfortunately, not many of us do so. For most of us, visiting a hospital, visiting a doctor is not an experience that we enjoy. In fact, it's something that we dread, put off as much as possible, and most of us think that going to the doctor is something that we should do only when we are really feeling unwell or when we need treatment for specific medical conditions. Even that happens only when we find the time to do so or when the symptoms are really unbearable, can't be sorted out by that self-prescribed pill or home remedy. But just as your equipments in office and home have a preventive maintenance schedule, your body too needs to be checked at regular intervals to keep it in sparkling condition. Preventive health, what we are going to discuss today, refers to routine care you receive in order to maintain your health. It's key to diagnosing medical conditions much before they become a problem. So today we're going to talk to our expert on how you can unlock the power of preventive health screening. I'm delighted to welcome Dr. S. Sujatha, who is a senior consultant at Apollo Hospitals, Chennai. Dr. Sujatha completed her MBBS in 1989 from the Tanjavur Medical College, postgraduate diploma in diabetes mellitus from the Annamalai University, and currently she's been a consultant physician at Apollo Hospitals, Chennai from 2005. She has a vast experience as a consultant physician, managing complex medical problems and also spearheading our preventive health program, and has also served as a senior consultant in the Department of Preventive Medicine at Apollo Hospitals from the year 2005 till date. She's on the panel of several immigration services, Canada, Australia, New Zealand, Korea, and formerly was a physician for the pilot medical examination with BGCA as well, and has also contributed to many chapters, for example, a Manual of Practical Medicine, which is a widely read book for postgraduates in medicine. Thank you so much, Dr. Sujatha, for joining us today. It's indeed a pleasure to have you here in our session. Let's begin by asking you the most basic question. What is preventive health screening?
Thank you, Dr. Srinidhi, for a wonderful introduction. And preventive health screening, by which we mean this is a concept by itself. It is brought up earlier in 1980s by our chairman when the rest of the world hadn't thought about it. He organized a health program in which there are series of medical examinations, including X-ray chest, ECG and other ultrasound, abdomen and other imaging modalities, and which is aimed at bringing out the hidden health problems and also help to manage the existing health problems well.
So, why should we really do preventive health screening at all? I mean, what are its advantages?
As mentioned by you in the beginning, it helps in detecting the diseases at a very early stage before the symptoms manifest. For example, cancer that can be detected by a routine examination, or a hypertension or a diabetes, and the common routine problems can also be detected by a proper history and a medical examination, even at the basic preliminary level. So I think it is very, very important for us to undergo the health screening to understand our basic health status so that we focus on the trajectory, how we can take it so that we avoid complications.
So, could you expand a little bit more on what are the important health conditions that can be diagnosed early before they actually cause any symptoms by doing a preventive health screening?
Common health conditions like a high blood pressure or a diabetes mellitus. Now we are the world capital for diabetes. India, every other person is a diabetic or a pre-diabetic. So by detecting it at the very early level, we can prevent the progression of the disease from pre-diabetic state to a diabetic state, or a pre-hypertensive stage to a hypertensive stage, by health care analysis and health, lifestyle modifications that we advocate, in addition to the medications. And the advantages being, which is a cost benefit for the individual as well as the country, in addition to the health benefit that it gives.
And what would be the potential long-term benefits of doing something and diagnosing it early? Like, could you give us some examples of diseases where, it is better to detect them at an early stage?
For example, diseases like cancers, like during a routine health screening, some of the cancers can be picked up. We do routinely pap smear for women to detect the cervical cancer at a very early stage, at the stage of intraepithelial neoplasia. Even before the disease would manifest, we can detect it and take appropriate action for the same. And breast lumps, and we do a mammogram to find out if it is a cancerous one, which is followed by a biopsy and what is needed further for that particular patient. In addition to cancers, we also look at proper functioning of the liver, kidney, the hemoglobin status, whether somebody is anemic. These can give clue to the underlying cancers or any other diseases hidden. By analyzing the hemogram, the liver kidney function test, X-ray chest, ECG, and ultrasound abdomen, these can be picked up pretty early.
Also, what would be, because we have always prided ourselves in saying that, we personalize the health check. So, what is this concept of personalizing someone's health check, and is it really possible to tailor make it for each individual? How do we do it?
Yes, that is our USP. In Apollo, we personalize the health check, which is totally different from the health check done elsewhere. Generally, we understand by health check, we do a series of tests and investigations that will aid the physician to arrive at certain conclusion, and more or less those tests are standardized everywhere else. But here, we have a basic standard protocol. Over and above, we have a dedicated medical officer to do the history of the patient, which is lacking in any other checkup elsewhere. A detailed history is taken, which includes the patient's present health conditions, their past health details, their family history, personal history, including their smoking habits, alcohol, and whatever diseases happened in the family. That gives us a input into the patient even before we start clinical examination. And the examination brings out certain results, like a high BP or a presence of a mass or a pulse being absent or a presence of a cardiac murmur. So that guides us into which area we have to focus more on. This combined with the set of the lab tests that we are going to get the next day or subsequently will guide us to go into further in that direction so that we get the proper diagnosis and also we get the appropriate consultants to address the situation. Apollo is one talent pool and good set of senior consultant physicians, specialists, surgeons, and it is a group of talent pool. In addition to a physician who is examining the case, there is a gynecologist who is also involved in every female health check so that they examine the pelvic region, the pap smear is being done, pelvic ultrasound is done, and there's a rectal examination which brings out presence of hemorrhoids, prostate, or any other hidden things which are not done anywhere else. So with the combined history, physical examination, gynecologist and surgeon, we tailor it to that particular patient's needs. We don't do a routine checkup like a routine ERT check, eye check, heart check, like as a part of the package. What is needed to that particular patient, we take it across to that. That not only avoids excess of tests being done, but it also becomes cost effective and they can spend more on the problem hands-on rather than spending on something else.
I think that is such a vital difference of our health check program. Because today, the other thing that I wanted to ask you is that, there is a mushrooming of advertisements that there are master health checkups done, or, we get so much of, so there are a lot of labs also who are advertising like 100 tests, 200 tests. So I just wanted to kind of reiterate what it means to actually like when somebody has taken that step that they must have a preventive health check, that's a good decision. But the next best thing that they have to do is to choose the right place. So what would you advise a person who is flooded with so much of information about what's available? What kind of a place should you go to have your preventive health check? What are the prerequisites of something that is comprehensive and complete and something that's actually going to benefit you?
Actually, speaking, they have to choose a place where a comprehensive, wholesome checkup being done, meaning all the tests under one roof and all the specialists available on call or whenever needed in an emergency situation, and also a thorough interpretation of the test results, the diagnostic accuracy, the quality of the equipments. Here, for example, even with my own client, suppose I am doubtful about a test, then I can request the lab to rerun it and then tell me whether it is correct or not. And after reconfirmation only, I tell the patient whether it is right, which needs a brain to look at what is happening with the blood test. So that advantages, in addition to the specialists that are available that we have, I think they have to choose such a setup to do the preventive health check rather than going to the labs to do the tests.
Also, I know that we have been constantly evolving in the health check program that was first envisaged by the vision of our chairman. Today, we have something called Apollo ProHealth program. So what is different about it, and what are we how have we evolved? How have we expanded this whole concept of preventive health?
I joined the preventive health check program with Apollo in year 2005. And then on, I have been doing this checkup, and in front of my eyes, I see drastic change, right from the addition of tests to the consultants involved and not being stereotypical and trying to show variations, and the introduction of newer tests and AI bringing the cardiovascular risk score, the evaluation of psychological status, anxiety, depression, the sleep status, and everything is a new thing to our own health checkup, which was done a decade ago. So, basic improvisation in the level of testing, the doctors involved, the way we look at it, it has evolved tremendously. Now, reaching a state that I can probably say that we are the one who does a very comprehensive checkup compared to anywhere else in the world.
And what are the technological innovations or the additional tests that we have introduced? I think most people are aware that a preventive health program might have some blood tests, maybe testing for your lipids, sugars, anemia. They know that there might be a ECG or a chest X-ray or an echo. There might be a treadmill test, maybe a urine stool test, an ultrasound. But where are we in introducing better paradigms of diagnosis for earlier diagnosis? So what are the technological tools and the other things that we have introduced?
AI has gave a great contribution to the development of the test. More than doing the test, we follow the patients with our health coach who remind them periodically as to how to go about. But these are possible with the advent of new tests and computers paving a way, which makes the job easy. We have a whole body MRI introduced into the health check package that screens the whole body and brings out any hidden, even a suspicious thing to be looked at elaborately. That is very useful for cancer screening and for bone-related pathologies, the brain tumors which are hidden, not seen. Those are very important. And we have got microbiome analysis. Actually, when we talk about this itself is a big topic. Gut microbiome analysis is a unique thing for each individual. We call it which is equivalent to a thumbprint, microbial thumbprint, which is different for each individuals. That decides many of the parameters, which is the newly evolving functional medicine. And that we always say gut is the index of mind, and also there is a gut brain axis that has to be studied to understand this elaborately. So by the microbial pattern in the intestine, there are certain other diseases that can be sorted out in addition to the routine medications that we offer. That is one thing which is new. Then we do the genetic analysis that is done when the patient requests for a particular reason, like a neurological disease or a neuropathy running in a family, or a cerebellar problem, the familial problems, or a neurological and various biochemical parameters also, like glycogen storage disease. Those are done by genetic analysis. That is again a new thing which is introduced into the health check concept.
Also, are there any population-specific checks that we are doing, for example, for women, for children, for any such separate? Because apart from the organ-specific things, are we also looking at age or gender-related specific programs?
Yeah, of course we are doing. The health check is done for all ages, right? From pediatric age group to geriatric age group. We have a children's health check which is done in the pediatric hospital, adolescent, pre-adolescent checks, and as they turn 16, our adult health check. Depending on the age, there are health check packages for those who are less than 40 and that after 40, and for geriatric age group. Women-specific health, actually, every package has a gynecologist who is involved, and we do pap smear for all the eligible people who can go through the pap smear test to detect cervical cancer early. and also a mammogram for women above 40 years, and ultrasound breast for those who need an ultrasound breast less than that age. And in the geriatric care, we have the bone health, which is included, which is by a DEXA bone scan. We do the bone mineral density so that we detect the osteopenia and osteoporosis earlier before they land up with a fracture or something later.
So what do you see as, the key barriers? Like you must have seen thousands of patients in your career. So what makes people, like not so reluctant? I mean, why doesn't everybody do this instinct? And how can we overcome that barrier? Because we know that it's important.
Generally, public is afraid. One is the cost concern. The second one is they are confused. They don't know where to go and get it done properly. The third one being they are afraid that we might detect something. But they don't understand the very purpose of going through the health checkup is to detect something very early, even before the symptoms manifest, so that we nip it at the bud and the treatment is started even from that time. And the disease can be prevented at that time. For example, in a diabetic, if there is a hyperbilirubinuria, even before the kidney failure sets in, we can give the medication and arrest it at that point. So that is very, very important so that they can preserve their health. And for a community, it is a benefit. It looks at having a healthy community.
And what age do you think that these health checks should start?
As I mentioned earlier, it is from the pediatric group to whatever age. I have patients seeing me for the past 20 years, year after year. So for some of them, they might have had a cancer in the beginning and it helps to follow every year. And for some, they are normal, healthy individuals, but they don't want to get into a problem surprisingly. So we want to follow up every year so that they are aware of their health condition so that they don't get into complications.
And do we do these health check programs at workplaces and such on-site programs as well?
Yeah, we have conducted many camps. We can get the health check done in their premises. Whatever test that could be done there, blood test and small imaging, ECG, echocardiogram, portable echo, portable ECG, such things can be portable X-rays. They can use it at the premises. But for the tests which are not possible in the premises, they have to come here so that the time can be shortened. There is no absenteeism, like they can work and in between they can come for the health check and continue to work. So those are the advantages.
As we are in this session where we are addressing corporates and workplaces, employees who work in large institutions, what do you think that this population who is especially in the corporate sector, do you think that, they have to be sensitized even more? What kind of health problems they may be ignoring, and they need to really wake up and make sure that they're screened?
See, those who are in corporates, those who are in higher positions, first point is that they won't find time for doing the health check and for a proper exercise or following a routine. So it is very, very important for them to focus on their health, and they have to actually get into one of these comprehensive programs to understand the functioning of their body, in addition to their well-being with relevance to the stress level, anxiety, and those things also should be focused on. So I advise them to get into such programs early so that complications are prevented. With stress, they are more prone for heart-related ailments also. So that can be prevented if they screen them early.
So finally, doctor, I just wanted to ask you, I'm sure in your long experienced, you must have had many inspiring stories of people who had a health check and this made a huge difference to their survival or to their quality of living. Do you have any inspiring stories like that to share?
Yeah, many, many. Uh, every day there is one story to tell, but quickly, if I have to recap, I happened to see a 42-year-old lady who did the health check elsewhere. She brought the reports to me, and there was a tiny nodule in the lung that was about 4 to 5 millimeter in size. She came to Apollo to see me. Then we had organized a lung biopsy. Many of the early 40s women, non-smokers, they will be reluctant to do the testing. When I say a lung biopsy, which is an invasive thing, why to go ahead? This particular lady went ahead and it was found to be a small cell carcinoma. We did a lobectomy and 15 years now, and she is well. Every year she comes for a routine health checkup since then, and she will be thanking us enough every time she visits us. That is one example. And even today morning, as I was sitting in the OP, my first question was that I have to give her a clearance, medical clearance for a total thyroidectomy for a thyroid cancer. She said she started with this one. I came for ProHealth and I found to have a thyroid nodule, which turned out to be a cancer, and I am undergoing surgery. So these are some of the examples that will be very, very beneficial for their life. And many other area, cancers in liver, kidney, those things we have found out plenty. And any number of heart diseases, like as we do the treadmill test as a part of the package, and each one, many of them, each one is having, even though they have done the treadmill well, some of them we have found to have heart disease with their symptoms and other parameters, and many breast-related problem. As we did the mammogram, many breast lumps that are not seen by patients that we have found out, and some of the abdominal masses, ovarian carcinomas we have found out. So there is I cannot list everything here.
Yes, of course. So thank you so much, Dr. Sujatha, and I hope, dear viewers, that this session has motivated you to immediately book your screening and get yourself checked. The 6 steps to good health are, of course, to eat healthy, to get active, to keep moving, to stay at a good, healthy weight, quit smoking, manage stress, manage sleep. But I think from now on, you have to take this extremely powerful action that will supercharge your journey of good health and add to your productivity, your success, happiness exponentially. And that is screening yourself regularly. The human body is a masterpiece of evolution, billions of years in the making, a testament to life's infinite possibilities. So take good care of it. Thank you and